NHS staff have today begun vaccinating people aged 65 to 69 along with those classed as clinically vulnerable, with more than 1 million people already invited to book it. People aged 65 and over are next in line for vaccinations, after the government announced it had succeeded in its goal of offering a vaccine to everyone aged 70 or more by February. However, if there is anyone 70 or above who hasn't been vaccinated for any reason, including anyone who turned down the offer, they can go to www.nhs.uk/COVID vaccination or dial 119 today and arrange to be vaccinated. The NHS has also begun vaccinating people who are clinically. A list of conditions that are considered to make people clinically vulnerable is below. The government hopes to vaccinate everybody aged 50 and over by April 30th. Here's the full COVID priority list. Vaccinated already, care home residents, 300,000 people, and residential care workers, 500,000 people, everyone aged 80. 3 million people, healthcare workers, 2.4 million people, and social care workers, 1.4 million people, everyone aged 75 to 70. 3 million people, everyone aged 70 to 74, 3.2 million people, and people under 70 with a serious medical condition that makes them clinically extremely vulnerable. 2 million people, vaccinations taking place now, everyone aged 65 to 69, 2.9 million people, people under 65 with a medical condition that makes them at risk, 3 million people, due to be vaccinated by April 30th, everyone aged 60 to 64, 1.8 million people, everyone aged 55 to 59, 4 million people, everyone aged 50 to 54, 2.8 million people, to be vaccinated after April 30th, every adult aged under 50. Key workers such as teachers may be given priority, but the government has not yet confirmed this. The NHS has already sent out almost 1.2 million letters to people aged 65 to 69 and people classed as vulnerable, and other 2 million are due to go out this week. Those who receive a letter can choose from more than 100 large-scale vaccination centers or almost 200 pharmacy services. More high-street pharmacists are being invited to take part as the program continues to accelerate. Prime Minister Boris Johnson said, on the 8th December, just after 6:30 in the morning, this country's first coronavirus jab was delivered safely into the arms of Margaret Keenan at University Hospital in Coventry. In the following 2 months, this country has achieved an extraordinary feat, administering a total of 15 million jabs into the arms of some of the most vulnerable people. Those vaccines have been delivered in our NHS hospitals, in GP surgeries, in high street pharmacies, in cathedrals, churches, mosques and temples, in community centres and in living rooms in cities, towns and villages across England, Scotland, Wales, and North. We've even delivered jabs in a fairground. And they have been delivered by the most extraordinary army of vaccinators who have jabbed like there's no tomorrow, doctors and nurses, retired healthcare workers who return to the fray, and supported by organizers, volunteers, marshals, guided by the leadership of the NHS and supported by the great strategic, logistical new of the Brit. It has been a truly national, UK-wide effort. We have done it together. He added, if you're eligible for a jab but haven't had it yet but you want to join in, you haven't missed out. Just call 119 and the NHS will. And in England, I can tell you we have now offered jabs to everyone in the first 4 priority groups, the people most likely to be severely ill from coronavirus, hitting the first target that the Prime Minister said, but of course, no one is resting on their laurels. In fact, the first million or so letters offering appointments to the over 65s are already landing on doors. We've still got a long way to go to. And there will undoubtedly be bumps in the road. But after all we've achieved, I know we can go forward with great confidence. People defined as clinically vulnerable are those with chronic respiratory disease, including chronic obstructive pulmonary disease, COPD, cystic fibrosis and severe asthma, chronic heart disease, and vascular disease, chronic kidney disease, chronic liver disease, chronic neurological disease including epilepsy, Down syndrome, severe and profound learning disability, diabetes, solid organ, bone marrow and stem cell transplant recipients, people with specific cancers, immunosuppression due to disease or treatment, asplenia and splenic dysfunction, morbid obesity, severe mental illness. Health Secretary Matt Hancock said fears some people would simply refuse to take the vaccine had not come. He told Times Radio, in planning the program, we had to make an assumption on the level of take-up we expected, and I'm really pleased to say take-up has been far higher than we expected, and over 90%, in fact among 75 to 79-year-old. The take-up has been over 97%, which is absolutely terrific, because every extra percent matters, because that's fewer people who are not going to get the protection, and therefore everybody is, so it's a real success. The team have absolutely blown